Good afternoon, everyone, and welcome. My name is Sabrina Howard, and I'm a project manager with the Suicide Prevention Center of New York within the New York State Office of Mental Health. We'd like to thank you for taking the time to be here today. We know that many of you are coming from law enforcement, fire, EMS, corrections, and emergency communications, and we appreciate the people who spend their days and their nights keeping our communities safe, so thank you. Today's session is focused on the CARES Up funding opportunity for uniformed personnel organizations with more than 15 full-time uniformed staff. I'm going to walk through what CARES Up is and where it came from, who's eligible, what the model looks like, how the grant is funded, and the application and award timelines, including our December 3rd, 2025 deadline. Our presentation will be around 20-30 minutes long, so we'll have plenty of time for questions. Feel free to drop any questions you have in the chat, or you can unmute yourself. We're here to help you better understand whether this is an opportunity that fits your agency and how our team can support you throughout the process. We are also available via email for any clarification or materials you may need. And we'd like to ask everyone to take a moment to let us know who you are in the chat, and we'll get started. A couple of technical items before we dive into the content. Please mute yourself upon entry to minimize any background noise. Feel free to unmute yourself during the Q&A or when we pause during the presentation. Please introduce yourself in the chat. It can be your name, your role, your agency. It's helpful for us to see the mix of representation in the room. Feel free to drop your questions in the chat as you go. As I mentioned, we'll monitor the chat. This meeting is being recorded. The recording will be posted on our website, so you can share it with your colleagues who weren't able to make it today, or review if you have any content that you might have missed. I want to start by briefly introducing our CARES Up team. We're the individuals you'll be working with if you apply. Myself, Sabrina Howard, project manager, and I'll pass it over to Stephanie.
Good afternoon, everybody. Thank you for attending today's info session. Hopefully we'll have an opportunity to answer any questions that you have. We're really excited about being able to offer this funding once again. My name is Stephanie Lau, and I'm the Director of Workplace Initiatives at the Office of Mental Health Suicide Prevention Center, and along with this team, lead the CARES Up initiative. Unfortunately, Gara Lloyd Lester is not able to attend today, but he is also one of our team members, and he leads our sustainability cohort and our veterans cohort. And I'll pass it along to Nadine.
Good afternoon. Thank you all for coming. My name is Nadine Zeski. I'm an implementation specialist with your CARES Up team. I'm also a retired police officer who jumped into mental health, and really happy to be here.
Thank you. This team at SBCNY is dedicated to supporting our current and future CARES Up sites. CARES Up is designated and designed to be a partnership. So we're working alongside your site to provide technical assistance, connect you to resources and training, and help you develop and implement a wellness plan that actually fits your agency's needs. So if you are awarded, you'll have regular contact with us on a monthly basis for things like your work plan development, survey rollout, troubleshooting, and thinking through what policies or practices that support wellness at your site. So if you are listening today, we want to emphasize that we don't want you to just think about this as a grant. It really is access to a team whose sole focus is supporting you and your agency's wellness through strengthening resiliency, wellness, and suicide prevention for your team, regardless of where you're starting from. A bit of background on the grant. The governor's office designated $1 million in funding specifically to support uniformed personnel and veterans wellness in 2020, and tasked this office with developing a resource to connect New York State agencies. And so CARES Up was created by the New York State Office of Mental Health Suicide Prevention Center in response to the data and what many of you know from lived experience. First responders and uniformed personnel are at an elevated risk for suicide compared to the general population. On a specific discipline level, first responders such as law enforcement and fire are more likely to die by suicide than in the line of duty. And our commissioner, Dr. Ann Sullivan, captured it well when she said that CARES Up helps support the men and women who serve and protect us every day. and helps inform the public about the increased risks, challenges, and behavioral health needs of our first responders and veterans face. So the state has invested heavily in this initiative. In 2024, the governor's office announced that there will be an expansion of $2 million annually in funding to support suicide prevention and resiliency efforts among our veterans and uniformed personnel, including 911 dispatchers. And that is why we are happy to roll out cohort 4 of this initiative. And so CARES Up is an acronym. It was built with the direct input from veterans, law enforcement, correctional officers, firefighters, EMS, and 911 dispatchers through a statewide steering committee focused on helping those who help others. As we gear up for cohort 4 of this grant, the model of this workplace resiliency and suicide prevention continues to evolve based on what we've heard from agencies like yours across New York State. CARES Up is fundamentally an organizational change model for uniformed personnel organizations across the state. What does that mean? It means that we're not just asking you to run a one-time training or have a wellness fair and check a box. We're asking, how is your leadership involved when talking about mental health? What is the normalized culture within your agency when someone is struggling or after a critical incident? Are your peers empowered and trained to support one another? Are there policies and practices that make it easier or harder for someone to get help? CARES Up gives you where you can assess where your agency is now, the gaps, and build a concrete action plan that fits your size and your local supports. Uniformed personnel repeatedly face exposure to trauma and chronic stress, whether it's a correctional officer at a high stress facility or a dispatcher managing back-to-back crisis or an EMS crew responding to an overdose. Without support over time, we know that these experiences can impact mental health, relationships, and overall wellness. We recognize that wellness has to be workplace-based. You can tell people to go to therapy on their own time, but you can't expect cultural change out of that. And so we're looking to work on how your work environment, your policies, and your peer structures can actually buffer the impact of trauma instead of adding to it. This slide lays out the 5 major goals of the CARES Up program. I'm going to summarize them for us. The first being organizational and cultural change. We want wellness to be woven into how you operate on a daily, not just an underused side project. 2, reduce the impact of workplace trauma. That might look like a training on stress and trauma, skills for sleep, family communication, financial wellness, really whatever it shows on your team's data assessment of what their top needs are. Number 3, promote wellness at work. This includes formal care like EAP, counseling, but also other peer support, chaplain services, culturally relevant support resources, and other things you can think of that add a more robust overall environment for wellness. Number 4 being increased access to peer programs and other social supports. Peer supports can be one of the most powerful protective veterans when it is implemented safely and well. So that's definitely one of the goals that we try to stress. And number 5 being increased wellness options in the workplace. Since many agencies already offer something like EAP or a rec center, a gym, or a wellness team, we often focus on utilization. Utilization can be very low depending on the site. And so CARES Up is intended to help you create a plan to align those resources with the communication that's coming towards your team and to help fill the gaps. And really, as you think about your application, we'd like you to start picturing which of these goals resonates the most with the realities of your agency at the moment. Let's talk about eligibility. For this uniform personnel application, eligible disciplines operating within New York State include county correction facilities, emergency communication centers, fire departments, volunteer, professional, or combination departments. Combination fire and EMS may apply for this grant. Emergency medical services, and law enforcement departments. We also have a funding track for military veterans transitioning into civilian life, but today's session is focused on uniformed personnel agencies who are applying for our RFA with 15 or more uniformed staff. As I named the disciplines, if you're thinking, I'm not sure if we fit into one of these categories, feel free to email us, or you can drop your specific situations here in the chat. We're happy to talk through the specifics with you. And this information is also on the RFA, exactly as it's posted. And so eligibility for funding is based on both your discipline and your organizational capacity. There are three main application tracks. Number one being uniform personnel for agencies with 15 or more uniformed staff. This is the application that we're focusing on today. Number two being volunteer or small agency applications for volunteer or combined agencies, for agencies with fewer than 15 full-time uniformed staff, and for county fire EMS coordinators applying on behalf of multiple volunteer departments. Those agencies need to complete our volunteer-specific application on our website. And number three being our veteran serving organizations track. Please use the specific veterans application and review the info sessions for both volunteer and veterans on our website for more information. For today's call, if your agency has 15 or more full-time uniform staff and you have not previously been awarded a CARES Up grant, you are in the right place. If you're listening and realizing that we have under 15 members, it's totally okay. There is a separate information session and a separate application process that's tailored to you, and it is posted under our funding section, or you can email us if you have more specific questions. And so this is one of our most important slides. We'd like to emphasize that CARES Up is a framework for organizational change, not just a one-time program. If you're awarded, you'll work closely with our team to conduct a needs assessment or a survey across your staff to understand the stressors, the supports, and the priorities that your team has. We'll use the data to build a site-specific action plan, and we'll assess potentially how can we align policy, leadership messaging, and peer work with our overall outcomes. And we'll definitely make sure we work with your teams to implement resiliency and wellness initiatives throughout the 2-year period. The CARES Up tools and surveys that are mentioned throughout will really just be a guide to making different decisions, not just focusing on how you're spending the funds. We like to work alongside each of the sites to distinguish a clear line between your data, your activities, and the outcomes that you're working towards as an agency. A little bit about our application, the RFA itself. All of the application materials that you'll need are on the CARES Up website under the funding section. It is a package that requires you to review and submit all of the elements that are listed on the site. A few quick tips would just be that we want to make sure that we're using the sample budget as a guide. Don't feel locked into the specific example lines or items. The budget is just a general idea of spending and will be adjusted based on your approved proposal, quarterly payments, and discussions with your OMH team. Please make sure you are downloading the correct application for your category and for your agency discipline. And lastly, if you have already reviewed the RFA, you've seen that it's in a fillable PDF document. If you're experiencing any technical difficulties with the PDF application, you can submit a Word document or supplemental write-up to the application questions. Please ensure that all of your materials are labeled with your agency name and email the completed package to our site, our caresup@omh.ny.gov. And again, we want to highlight that the deadline is December 3rd, 2025, 11:59 p.m. Eastern Standard Time. And so we'll talk a little bit about the award itself. This is a 2-year grant cycle. Agencies are eligible for up to $30,000 in year 1 and $30,000 in year 2 for a total of $60,000. The award's purpose is to improve the workplace culture around wellness and mental health for uniformed personnel and to increase the protective factors that reduce suicide risk and support overall mental well-being. So the tools, the trainings that we utilize during this program, including the needs assessment and our work plan, is really an opportunity for your department to get a sense of where your members are, their level of awareness when it comes to wellness, and to engage your membership on what wellness is to them, thinking through questions such as what are we prioritizing, what sort of impact will this have to our department long term, and what benefits are we hoping to see. Here's a little bit on how the funding period and the structure works. The funding period is from January 2026 through December 2027. Our funds are typically distributed in quarterly payments based on the completed deliverables as stated in your contract, not by specific budget items. And lastly, our additional training-specific funding may be available for approved training activities depending on the overall budget, agency capacity, and your site-specific action plan. At the bottom of the slide, there are a couple of things that are listed, and these are things that would be eligible for funding, noting that you'll have a more refined sort of budget and work plan once you talk to your OMH program contact to make sure that it aligns with the model and your approved plan. The sample budget and the overview of what is included has been provided in the RFA document. And so this slide does summarize our timeline. The application is due December 3rd, 2025 at 11:59 p.m. Eastern Standard Time. All parts of the RFA must be submitted by email to our general inbox. The applications are scored using a standard tool by multiple scores to ensure fairness and consistency. And award notifications are expected January 2nd, 2026, so you can plan for the start of the funding period in January. We strongly encourage you to review all of the materials in the RFA package as soon as possible, especially if you are in a local sort of coalition or you are coordinating across multiple departments or you need local approvals. We want to make sure you have plenty of time to get your documents completed and signed. If you run into any questions at any point, please email us. We would much rather answer your questions very early than have you stuck on a technical detail that we can clarify for you the week of the deadline. Our team is here to help, and we'd like to open it up for any questions you may have now, and we can also support you via email after this session. And I'll pause here as we transition into our Q&A session. You can feel free to raise your hand, unmute yourself, drop your question in the chat. I see a hand from Jess.
Yes, I have a question. So I work with a EMS agency for a large hospital system in New York City. Our hospital, our health system has a number of like behavioral health units as part of it. And so I'm curious about um, the programs that we can use the grant funding on. Is that specific programs and training that you guys have already approved, or would we be able to like work with one of our internal groups to develop our own kind of training model?
So your team would be able to utilize trainings that are internal that are new that are on your radar. We're not prescriptive in terms of you have to work with these particular vendors. It would be something that you would submit to our team, letting us know what it is, who is sponsoring it, what the content will be like, so we can talk through what specifics may look like in terms of implementing that particular training. So yes, you would be able to decide on what trainings your site is interested in and what that looks like for your team.
It sounds great. And lastly, I'm having some trouble finding the RFA online for the greater than 15 uniformed personnel. Is that on the website, or do I have to email separately to get a copy?
It is on the website, and we'll have our team place it in the chat at right now, but it is under the uniform personnel. And then if it's under 15 individuals, it would be under the volunteer sort of funding site. So we'll make sure to send that in the chat,
Great, thank you.
of course. I also see in the chat from Renee regarding the letter of support, other than OMH, who would be appropriate. And so there are a couple of examples of who a letter of support can come from, depending on the type of organization that you are. You can also connect with your regional suicide prevention coalition for your county. There are specific designees and a website to identify who those might be for your county is also a part of the RFA website. So we'll be sure to drop that in the chat. I have another question from Martin. If I need help filling out the application, could I arrange a time to call to clarify some questions? Definitely. We would love to connect with you and answer the questions you have about the application generally. If it is something in terms of clarifying the question or making sure that you have the right materials, our team is happy to set up a time to chat. You can reach out via email and we'll be sure to get back to you. Any other questions? Feel free to come off mute. Or if there's specifics about the presentation that we can review. We have a question in the chat. Are there items you discourage budget being spent on? It would definitely be something that we address on a case-by-case basis with your project manager, since we are open to ideas of what training looks like, of what particular items looks like through your experience in implementing the program at your site. It is something that we're having a discussion on. We do meet on a monthly basis. We do talk about the budget. We talk about training. We talk about updates. So it is something that you can send over to our team, and we'll be sure to kind of on a case-by-case basis let you know what would fall underneath the grant. We do want to make sure that our sites are focusing on their action plan that they created when we start the initiative. And they're also falling within the scope of what the program is intended to do when it comes to resilience and wellness within the workplace. So although that seems very broad, that's part of the point, but we will have those discussions one-on-one. And we do have examples of the main categories in the RFA application itself that we want all of our sites to start thinking about.
And if it's all right, I am going to interject. Sabrina, I think one of the things that's often surprising for many of our awardees is that there is some flexibility in terms of like how you spend those dollars. But I think that the key, to what Sabrina has sort of talked about, it really is that assessment piece and that action plan that you develop and ensuring that like the way that you plan on spending your funds aligns with that. Because when you're talking about the wellness of your organization and sort of really working towards implementation of the CARES Up plan, the CARES Up model, the idea is that you have done this assessment internally and you're working with your members to identify the best way to advance wellness across your organization and integrate it into the fabric of your organization. And so, we welcome opportunities to be creative, because I think there isn't any one prescriptive way to be able to do that. And because every site is so unique. And so for us, it really is about just ensuring that you have the opportunities to be able to really implement the model and implement opportunities to engage people in this effort across your organization.
Hello. This is Lisa Travasso. I am the head of the Wellness Division for the New York State Department of Corrections and Community Supervision. The Wellness Division is it's very new for us, and we are getting it in dealing with both corrections and parole with our facilities. In our proposal, do we need to include each facility, each parole office, or can we use it as a general? At the department, because we're New York State Department, how we would use those fundings? Do we have to specify each facility, or our facilities and our parole offices as a whole, in a sense, if that makes sense? So when we're writing our proposal for each facility, are we stating what our plans are, or as the department as a whole? For instance, training and any type of funding would be offered then to all of our facilities and our parole offices, or do we need to be specific in what areas each would receive?
So it sounds like you have multiple departments or facilities underneath the same sort of umbrella.
Yes, we do.
Okie doke. It would be helpful for us to know that as part of your application, just to have
Okay.
a sense of the size. We do ask questions about the number of individuals, the number of departments, the number of civilian staff you may have, to see what that may look like. If the organizations all have different sort of points of contact. So if you are the point of contact across all of these sites, you'll be working with them on an individual basis to roll out a training or a program or an event across the different sites. We would like to know that information. We want to know who's the lead, how many facilities or departments will be involved in varying capacities. And so you won't have to apply for each individual facility, but we do want to have a better sense of how many facilities, who's the point of contact, and what the plan would be to kind of roll out the CARES Up program across the different sites, knowing that there's different departments, varying capacity, and the engagement may look a little different.
Thank you so much. And this is also including our parole officers, correct?
And so you're saying that your parole and probation departments are a
We
little bit,
are under the department, we have corrections and community supervision,
okay,
which include our parole officers in the community
okay.
throughout the state.
And so we do have, it seems like you do fall under the category of corrections as listed in our eligibility criteria, but it is
Yes.
something that we would want to probably further discuss, or you can indicate on your application, because parole is something that's not specifically outlined on the eligibility criteria. But if we can understand a little bit better how your agency is set up, then we would be able to tell you whether or not there are multiple different departments that would not be eligible underneath this particular grant, because it is focused on county corrections versus certain departments being eligible and certain departments not being eligible, if that is helpful.
Yeah, and just
Okay.
to add another point of clarification, unfortunately, this funding, because does not include, or eligibility is not for any state funded entity. So
Okay.
I'm unclear. Maybe you could just sort of clarify for us. Are you a state? Would you be considered a state entity?
We are New York State Department of Corrections and Community Supervision.
Yeah,
We are a
unfortunately,
state.
yeah, unfortunately, the funding is for any state entity that includes, state police or even like SUNY University PDs are not eligible. And the reason that we've been told is that because this is state allocated funding and you are already receiving state funded dollars, or you are funded with state dollars, it's considered sort of like a duplication, or sort of like, the state looks at it as like, oh, you're getting double state money. That's the sort of the
that may,
clarification that we've received.
thank you. That is that very good. So then at this time that we would not be eligible, and because we are a state agency.
Unfortunately, yeah.
Oh, well,
Sorry.
thank you. But this is phenomenal for those that are eligible. But thank you. Thank you for that clarification.
We do have another question in the chat. Is it allowable to use grant funding for department outings designed to improve morale and foster support among officers? So yes, it would be something that we are looking to increase morale, to strengthen our support systems in the workplace and outside among officers, among families. That is something that is encouraged through the grant, and something that we would talk through as part of your original work plan on what you're looking to do and what that looks like for your site. Since we want to make sure that we're building connection and fostering those relationships within the workspace, we also want to make sure that we're doing it with intention, and not just for one's particular barbecue or a field day, but making sure that it is worked into the sustainability of what that looks like at your site, how we're talking about resiliency and wellness, and having a plan moving forward to make sure that we're having true impact, positive impact, based on what the needs of your agency looks like through the data that we're collecting from your team.
And sorry, just to go back to Lisa, although you may not necessarily be eligible for like the funding, we do through our office still offer some level of technical assistance. So I certainly encourage you to reach out to us, and we can connect with you, schedule a call, and talk through like what are your wellness efforts, what are your thoughts about advancing those efforts, and what are some available resources that potentially we could share with you.
Thank you so much. And I definitely will do so.
Look forward to it.
Just another point that we'd like to bring up is about any of the materials on the website, any questions you may have as you're working through them, any technical difficulties, please feel free to reach out to our team. If you do have questions, you're halfway through your application, or you have questions about our volunteer session, you have questions about the veteran session or the materials, if you can't find something on the website, please feel free to reach out. So it seems like we don't have any more questions at this time. We appreciate you for joining us, and we look forward to your applications.